I had a problem with my lower back, and I had a problem for years through training. I did a fireman's carry and had to do some maneuvers that way, and it hurt my back. I fell, and then I remember having a numbness go down my legs. Just through the years, it's just been gotten worse, where it's spread, where I feel like the way I stand is definitely different. How I walk, I get now like pains on the inside of my knees. My ankles are they seem to roll now because it just doesn't seem straight. I have problem breathing because just the tightness in my back, so it hurts to cough or take a deep breath inside. And then just like pain in my neck, and it's like very hard to stay asleep. So I'm constantly waking up, or it's just not straight sleep, so I'm always tired. So I like to try to get this better where I can just even walk right, because I get like pains in the side of my hip as well. So that's what I like to do.
So there's a chronic nerve right here. I feel going my finger over this fellow. So there's some chronic swelling right here.
Yeah.
You feel that, right? It's supposed to be nice and smooth, but nope. A little pitting edema right there. And when we test the structure, pain.
Yes.
Yeah? And it's also stuck. That fella ain't moving. Similar story with this fellow over here as well. Right?
Yes.
There's some chronic swelling over here. And when we test it, how's that fella?
Yeah.
Not fun, right?
Not fun.
Yeah. And when we test your sacrum, it's somewhat stuck. When we check every level, the second sacral segment is out. Okay, so we got this fellow over here. We got this fellow.
Oh my gosh.
But which one's worse, the top one
Yes. Yes.
or the bottom?
The top.
Top. All right. So when I take a look at your films, you got two issues that we already identified, but actually a third one. So take a look at your low back, and we tested on you. Right?
Yes.
That fifth lumbar. That fell over here, right? Normal. I want to see it in proper alignment like this.
Yes.
I don't want to see it way backwards like this. So when it's in proper alignment like this, see how stable it is?
Yes.
Right? Just some movement. It's supposed to be doing that.
Okay.
However, when it gets knocked way backwards like this, see how much more movement there is?
Yeah.
It's very unstable. In addition to, we also see where the nerve exits to?
Yes.
That space narrows. Happy over here, plenty of space.
Yeah.
Or when it goes backwards, it decreases significantly. I measured yours. Yours is 9 millimeters backwards. That's not just a small amount.
Yes.
That's a lot. I also identified that second sacral segment. Yeah, we tested on you. You weren't too happy with that, but the one with the most pain is that fifth lumbar. So this is what we're going to correct first.
Yes, sir.
And the one that also help explain why you're experiencing all that pain going down your thighs, the knees, including your ankles where you feel like you're rolling them in. All because you don't have proper nerve function from this fifth lumbar nerve.
Oh.
Right? Because that's like the sciatic nerve. It traces all the way straight down to your feet.
Yes, sir.
So it's not working properly anymore. What's the deal with rolling the shoulders, all that crepitus, all that noise?
Yes.
Right? That's this fellow over here. We see over here, nice and straight. That sort of looks like nice and straight, and then goes lean over to the right. This one leans over to the left. Why? Because this fellow is what started it all off. It caused a torquing motion,
Okay.
like a corkscrew, all the way to the top, and over here is trying to untwist opposite direction. This one took a hit. Right? That fellow got knocked out of alignment, and now it's pinching off the nerve. And that's why you have decreased nerve function to both your shoulders.
Yes.
So in order for you to help restore the nerve function to your shoulders, fifth dorsal, that's what we need to correct. Fifth lumbar is the one for your knees, legs, feet, and ankles.
Yes, sir.
Okay, so for this one over here, we're going to do a laminar transverse contact because there's a significant posteriority and he's still in an acute pain. So the laminar transverse contact is ideal for this particular condition. Oh. Come on up. Walk around.
Oh my goodness. Oh. Oh. Like I can
Turn around. You gotta show me.
sorry, it's like I can like breathe deeper, and it's like it, like the flow, like the I don't know, it's like it really went warm to the top of my head.
Mm-hmm.
Yes, sir. A little bit dizzy.
Well, that's to be expected because remember, you're winded up.
Yes. Yes.
Pretty intense there. So
Oh man.
we got
Like,
twisted your spine quite a bit there.
I can breathe a whole lot better. Yes. I didn't realize I was tight. I mean, I realized I was tight, but not like that though. Oh my gosh. I feel better, yeah.
Ready for part 2? We're gonna fix your mid back.
Yes.
Let's roll.
Sure, let's do it.
Just relax, right there. Just relax the shoulders. Just gonna relax a little more. Whenever you're ready, come on up.
Oh, wow. Oh man. Oh, that feels pretty good.
All right, so fill us in.
Oh, wow. So I definitely, when I take deep breaths in, I don't feel like the tension in the back, like how I was feeling earlier.
Mhm.
And I don't feel the pain right here. And it's more relaxed up on top. Like I was feeling real tense, and it's like my body's like letting go. Yeah. And I can move like this without a lot of pain. So that felt really good. Yeah. I could not taken deep breaths like this before. So thank you.
You're very welcome.
Yes, sir.
And thank you, Sarge. We're all set, Sergeant.
All right.